Good afternoon and welcome to our monthly webinar. Today's webinar is titled Associations of Fitness and Academic Achievement, a study of 13 Texas school districts. My name is Peter Cribb and I'm the National Director for the CATCH program with the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health, the Austin Regional Campus. And as always, we're in for quite a treat today. We're very excited about today's webinar, but before we get started, I would just like to take a little time for some housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the catchusa.org website, along with a PDF of the presentation slides. During today's webinar, we encourage you to type in questions and comments via the questions box, which you can access through the control panel on your screen. You can type in your questions at any time, but to keep us on schedule, we'll try to hold off answering them until the Q&A portion at the end of the presentation. Next, I'd like to share a little about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families, and communities. Our work fosters improved health behaviours among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. Our vision is healthy children in a healthy world. I'm also very proud to announce today that CATCH has created the CATCH Global Foundation, a 501c3 whose mission is to secure and provide private and public funding to implement and sustain CATCH in partner communities in the US and internationally. Now I'm extremely delighted to introduce our special guests for today's webinar, Duncan Van Dusen and Dr. Stephen Kelder. Duncan is the Executive Director of the CATCH Global Foundation and a social entrepreneur with over 20 years of leadership experience in both the for-profit and non-profit sectors. Before spearheading the foundation of the CATCH Global Foundation, he co-founded Tango Health to help employees and individuals adapt the new world of consumer-driven healthcare. Prior to Tango, Duncan was the Senior Vice President of Sales and Marketing at Works and drove the steep revenue growth that resulted in a strategic acquisition by the Bank of America. Duncan holds an AB from Princeton University and a Master's in Public Health from the University of Texas and is an avid language learner. Dr. Stephen Kelder is a professor of epidemiology at the University of Texas School of Public Health and the co-director of the Michael and Susan Dell Center for Healthy Living. Dr. Kelder has over 20 years experience in design and evaluation of child and adolescent research, particularly interventions directed towards youth, schools, and parents. He has been one of the lead CATCH investigators since 1992. He has published over 120 articles and has authored 9 textbook chapters. Recently, Dr. Kelder served on the Institute of Medicine's Committee on Accelerating Progress in Obesity Prevention. Today, Duncan and Steve will be discussing the associations of fitness and academic achievement. Good afternoon, Dr. Kelder.
Hello, Peter. Thanks for the nice introduction, and I'm glad to be here. I'm looking forward to this. I am located in Houston today, so I can report that it's pretty hot and sweaty in Houston. But anyway, I'm going to talk about the Association of Fitness and Academic Achievement. I'm going to give a little bit of an introduction, and then Duncan is going to present the results of a study that he conducted a few years ago. Now we have the data for it. So please put the slide forward one. Okay, well, one of the things that we're often asked is, why is this important? Why is it important for us in the research community to establish this association? I remember that at the beginning of my career, in the 80s and 90s, when we had a new and innovative school-based program, schools were more likely than not to welcome us with open arms and say, well, yeah, we want to improve the health of our children. But the world changed since then, and it changed in a way that meant less time available for health education for children, so particularly physical education. And because of that, school superintendents and other groups interested in schools and their functioning began asking questions about, well, does PE, physical education, does physical fitness actually influence a child's ability to perform at school? Because underneath it all, I mean, that's the primary mission, is to train our students to be cognitively ready to be good citizens in society. So I believe fitness is very important. But another question is fitness related to academic achievement? And if it is, then there's a stronger impetus for schools to go ahead and do that. For those of us in the health community, schools they're certainly a crucial place as a site for physical activity, both to implement and try and increase kids' levels of physical activity. But schools are a great place to do surveillance too, because most of the kids are there. So surveillance meaning let's measure them, let's find out what's going on, and this study is part of that. Schools are also evaluated and funded based on standardized tests, and then showing a connection. We hope we can enlist and support school administrators for this. In Texas, at least, and probably in many other states too, there are requirements for standardized academic performance testing, and more states are now using fitnessgram testing to measure a child's level of fitness. Next, please. So this is one of many slides that I could have chosen to do, and I'm not going to talk much about these brain scans, but here we have it, fMRI imaging of students after sitting and after moderate physical activity. There's an increasing amount of scientific and medical information trying to understand exactly what happens when we engage in physical activity. And this slide is just meant to say that there is brain activity. You can clearly see it here. Next, please. So a few years ago, there was a report that came out, and you see the cover here, the association with physical activity and physical education academic performance. 3 key findings came out. I believe this report came out in 2011. The 3 findings are written there, but basically the report lists through hundreds of different studies and tries to categorize them and come up with a conclusion. So what we know from this report that tried to accumulate the evidence is that physical activity improves academic achievement. We know this now. Physical activity impacts cognitive skills, including enhanced concentration, attention, and improved classroom behavior. And the studies show an increase in academic achievement when additional time is provided for physical activity, even when the time is removed from academic instruction. So basically what that means, and this is an important point from one of Jim Salas's studies several years ago, is that when you add when you increase the amount of physical education, physical activity time, you do not see any reductions in academic achievement. It's important to show because every moment is precious now in schools. So with these findings, there's stimulated since around 2009, 10, a whole set of more studies, and I could review many of them. And there's a number of meta-analyses and reviews that are available that say basically the same thing, just with an increased amount of precision. So I think it's fairly conclusive that physical activity, physical fitness will improve academic achievement. We know this now. We've known it from cross-sectional studies. We've known it from case control studies. We've seen it in longitudinal studies. then one study I'll mention just briefly is one that we conducted a few years ago, which is still under review, and that is when you increase the amount of physical activity, children who have a little bit harder time at school, measured by some school-based counseling skill test measurements, show an even bigger increase in physical activity with a randomized control study. So we have lots of evidence for this, folks. If you're out there in a school and you need evidence to talk to your superintendent to say, let's do this, the analyses that I did is that if you increase physical activity in classrooms, even with something as simple as classroom activity breaks, and leave the physical education program alone, of course, don't reduce it. But if you just insert classroom activity breaks, you'll get about a 10% increase in your standardized test scores. That's a pretty good number. Next, please. So a number of unanswered questions. Next. So what is the association in standardized test scores with each individual fitness measure across diverse populations? Next. How do these correlates differ by gender and grade level? And next. What is the dose-response association by incremental increase in fitness? So these are the questions that Duncan Van Dusen set out to try and understand a bit with the study that he conducted. So I'm going to pass it over. Oh, sorry, I forgot the fourth one. I'm going to pass it over to Duncan. Take it away.
Good. Thank you, Steve, and thanks everybody for joining. So like Steve mentioned, when he and I started working together in about 2007 or 2008, there already was a certain amount of literature on the subject of correlations between fitness and academic achievement, but not enough to convince school administrators that were under increased pressure from, in particular, the No Child Left Behind Act to reduce curriculum allocations to physical activity. So we set out to answer some of these questions with a greater degree of precision, and what we benefited from was a law that was passed in the state of Texas in 2007-2008 era, which said that all schools must test all of their students from elementary all the way up through high school with FitnessGram twice a year. And because, of course, the state of Texas had already been doing academic testing for that same population through the TAX test, which has subsequently been replaced, but at the time it was the TAX test, we were in a very, very unique position of being able to have simultaneous data for students' fitness and for those same students' academic achievement. So we were able, because of course Texas is a large state, we figured we would be potentially able to get a very large amount of data and be able to do some of these to answer some of these more sophisticated and detailed questions that you see on this slide for the first time. And so indeed we did, and we were able to get 13 school districts from around the state of Texas to contribute matched FitnessGram test results with TAX standardized academic test results. And they were, of course, all anonymous, but we knew based on codes which student had what fitness result and what TAX result. So we were really able to analyze matched test pairs. In total, we got over 250,000 records, 315,000. Those represented students in grades 3 through 12 because the TAX testing didn't start until grade 3, so there was although there was some FitnessGram testing below grade 3, we didn't have the academic tests. So that was actually about 10% of the total Texas population of school children, which is a huge, huge sample. We were able to collect those, like I said, from 13 different districts in 8 geographic regions in the state. So the state of Texas is divided up by the TEA into 20 regions, and we had 8 regions represented, which gave us a good cross-section. The big difference between our sample and the population was really the portion of students that were in large districts. So we had well over 80% of our sample was from large districts. On the other hand, only about 1/4 of Texas school children go to school in a large district. And the main reason that our sample was so kind of stilted there was just because of IT capacity. So the large districts were able to get us those matched pairs of data, and unfortunately many of the smaller districts just didn't have the technical resources to be able to pull the data from different systems or give us a code or any way of matching them up. But in terms of the portion of economically disadvantaged students, the distribution of ethnicity, and also the school level distribution between elementary and middle and high, you can see there that our sample was actually very representative of the total population of Texas. And so we were pleased about that because it allowed us to feel like we could generalize some of our findings across the state. So I'll talk now about each one of those 4 questions that Steve and I came up with, what we found. So the first one was looking at, by fitness measure, are there any associations between fitness and test scores? And if so, what are they? And to simplify the question, we just looked at the reading and math tests, and primarily because those are the only tests that are required every year. There are certain other tests like science and social studies, which at that time were offered sporadically. So science might have been in 5th and 7th grade, and social studies might have been in 4th and 8th or whatever. But we just looked at reading and math because that was offered in every grade. And then we looked at the 6 components of the fitness gram battery, which are cardiovascular, curl-ups, or what we used to call sit-ups, which is kind of a core strength measure, push-ups, sit and reach, and trunk lift. Sorry, 5 measures. And so one of our goals was to really understand, well, if there is a correlation between fitness and academic performance, what kind of fitness are we talking about, and what kinds of academic performance are we talking about? And as you can see from this slide, the differences were very, very significant. So by far the most important fitness measure as it regards academic achievement is cardiovascular. And you can see that in boys and girls, in reading and math, there was a statistically significant difference between the most cardiovascularly fit kids and how they performed on the standardized test, and the least cardiovascularly fit kids and how they performed. So that's a big, and 50. Those differences were in the range of 50 to 100 points, which is a very, very significant difference in terms of the school's evaluation measures. As we look at some of the other tests, you could see the next most important fitness measure after cardiovascular is curl-ups, which is basically a measure of core strength. And indeed, although those are not quite statistically significant in reading, they were statistically significant in math for both boys and girls. And then so on down the line. Push-ups was kind of in 3rd place. Sit and reach and trunk lift, which are more measures of flexibility, were further down the line. So although there was a positive difference between the most fit and the least fit, it didn't pass the statistical test that we said. We also noticed, as is quite apparent from this slide, that the correlations between fitness and academic achievement were much more prominent on the math test than they were on the reading test. And we don't know why that is, but it's an interesting finding, certainly for future research, and definitely shows that if you want to get math scores up, those cardiovascular fitness and core strength fitness may really help you do it. So that was the first question. The second question was, how are these associations by grade level over time? Are they changing? Are there certain age groups where fitness seems to have a bigger impact on academic achievement? And again, we had some very interesting and non-obvious findings. Primarily that there seemed to be kind of 2 sensitive areas. One area in the kind of middle of elementary school, so around 3rd and 4th grades. And again, you can see for both reading and math, for both boys and girls, that in 3rd grade and a couple of the 4th grade tests, there was a difference between the most fit and the least fit in terms of how they performed. Those differences became less significant in the upper elementary and early middle school grades, so kind of 5 through 7, it became less significant. But then they came back very strongly in 8th, 9th, 10th, 11th. So the upper end of middle school and the bottom end of high school. And this is very important, we thought, and we'll talk about this a little bit more in the implications, because this is essentially adolescence, right? Early adolescence, around eighth, ninth grades. This is a period of life when many schools are relaxing the amount of time allocated towards physical activity, because curriculum is getting more demanding academically. They need time. Maybe kids are getting interested in other types of extracurricular activities, and so they make more time in the day by reducing allocation to physical activity. But yet this is a period where that very physical activity has potentially a huge impact on standardized test outcomes. So we thought that was a very, very interesting and important finding. On the subject of the third question, which is the cardiovascular, what we call dose response, let me just explain a little bit about that test. So basically, what we're measuring in that test is we're looking at each quintile, in this case of cardiovascular performance. So basically dividing all the results, and all the results were age and gender adjusted. Who's in the bottom 20%, who's in the next 20%, who's in the third, and so on, into 5 groups, 1 through 5. And so what a dose response test is doing is it's basically saying, well, is each unit of fitness giving you an additional unit of performance on academic tests? Or do you get to the point where once you're fit enough, then there's no further yield in terms of improved academic performance? And what you can see here is, I think, very striking visually. It's quite obvious that there is a trend, and that trend, for the most part, holds up, where each unit of additional cardiovascular fitness is yielding an increase in the standardized test score. And then we run a series of statistical tests on it to see, is the trend strong enough to pass certain statistical tests? And we found, again, that for both reading and math, the answer was yes. It was clear that we could be confident that there was a trend whereby the cardiovascular dose response is leading to improved performance on the fitness test. So this is very significant finding, again, for school administrators and school boards, because if most of your kids are in the first and second quintile statewide, and you can move them into the second and third, or the third and fourth, or even the fourth and fifth, well, you can expect that you may have some increases in standardized test scores to go with it, which is, of course, what they're looking for. So that was a very, very significant finding. And it took a very large amount of data to be able to do that. On the fourth question was about the correlation of BMI, which is body mass index, and test scores. And so this was an interesting one, because we were, in order to do this test, what we did was we essentially subtracted out the effect of cardiovascular fitness and curl-ups. So we were essentially saying, okay, well, let's just suppose for a second that people with higher BMI may have lower cardiovascular fitness, which of course is what the tests show. But if we subtract out the portion of the impact that's from that cardiovascular fitness, and we just look at the portion of the impact that is from the BMI, well, then what do we see? And very surprisingly, and we were expecting, this is one of the beauties of science, you don't always get what you're expecting. We were expecting that those people in the higher levels of BMI would probably have lower test scores, because indeed, if you do that test without subtracting out cardiovascular fitness, that's what you find. But when we subtracted it out, as you can see, it isn't nearly so clear a picture. In fact, on the math side, it's actually the lowest BMI people that have the lowest tax standardized test performance. So this was very interesting and frankly somewhat puzzling finding that just the body composition really had no impact on academic performance if you don't take into consideration the association between body composition and fitness. So that also, we think, has some pretty interesting implications for the curriculum. So that's essentially what we found through those 4 questions. This is a map that actually wasn't part of our study, but kind of a related study, which took those same test results by county for the cardiovascular tests and compared them not at an individual level, but at a school level by county. And what you can see is basically the red colored counties are those with the lowest fitness, and the largest dots are the ones with the lowest tax scores. And then conversely, the green counties have the highest fitness, and the small dots are the highest tax scores. So what you can see is, although this isn't showing, none of this is saying anything about causality, because it was all cross-sectional data. But what you can see is there's a very, very strong association across the entire state between those areas that have the lowest cardiovascular fitness and those areas that have the lowest tax scores. So if you're a school administrator or if you're on a school board, it certainly makes you wonder, well, can we safely ignore this correlation? If what we're trying to do is improve learning, and we're measuring that primarily by doing standardized tests, and there's this strong of a correlation between the results on those standardized tests and certain measures of fitness, particularly cardiovascular fitness, can we ignore that? And that, I think, is why a lot of this work was very compelling to some of those administrators and school boards, because they, in anything that could potentially have a connection with standardized test scores was something that they wanted to look at. So, talking a little bit about, and by the way, the study that we just talked about was published in the Journal of School Health. Some of you may have seen it. If you're interested in a copy of the full study that explains the methodology and more about the tests that we ran and so on, and has all the tables, just email us and let us know, and we'll be happy to share it with you. And one of the things we put in the study and that we've talked about as we've done this presentation is, what are the implications of what we found? So first of all, let's talk about the implications for research, because of course, almost all research ends with the conclusion that more research is needed. So the first thing that we definitely saw is what we found in terms of correlations and associations was definitely strong enough to merit looking at longitudinal relationships. So looking at relationships over time and seeing, are the changes in fitness coming first and then changes in standardized test performance? Or are the changes in standardized tests coming first, or are they happening simultaneously? Or what's happening over time? Because that is an important variable to look at in terms of trying to establish some kind of causality, is what's happening first in time. So that's a big opportunity for research. A second one that we have some of the data to do and have not conducted all the analysis is to look at correlations of fitness and school attendance. And there's two reasons that is very, very important. Number one is kids can't learn unless they're in school. And so a lot of the efforts that we found of school boards and administrators focus not only on standardized test performance, but attendance, because the kids need to be there. And if indeed there are any correlations between fitness and a child's likelihood to be in school, then that's something that schools are very interested in. And a second reason is a very practical one, and that is, at least in Texas, that census, that daily census of attendance, is how schools' revenue allocation from the state is determined. So if the schools can boost attendance, then they can boost the revenue that they're getting from the state. And that's just a very simple and obvious concern. And so again, boosting attendance is an educational outcome in itself for at least those two reasons. The third suggestion for further research is to look more into the mediating biology. So understanding, why is it that cardiovascular fitness might be associated with increased academic performance? How could that be? Why would that be happening more on math than reading type tests? And where would the core strength be coming from? Steve showed earlier the brain scan of somebody who was sitting and then somebody who had just had moderate physical activity, and obviously activity increases oxygenation, and the brain runs on oxygen, so there's at least some plausibility there. The strength measures, core strength measures, is potentially less obvious, So that is certainly something that might be worthy of study. The second category of implications and thoughts for what's next is around policy. So one of the recommendations that we made was that we're public health professionals, so we think in terms of having healthier populations, and it's pretty obvious why allocating time to physical activity and physical education would help have healthier populations. But what's not obvious to people is that there are educational benefits to this. So really seeing what policies could take into consideration that having stronger PE standards, especially in these sensitive periods that we identified, late, middle, and early high school, could lead to better educational outcomes. A second point that we made for policy was the opportunity to improve reporting around this fitness testing that was being done so that we could facilitate surveillance and also study some of these temporal relationships that we talked about. Like I mentioned, we had to do a hands-on manual job to get all this data from the districts, and we were only able to get it from districts that had a reasonable amount of willingness and technical capacity. But we would love to see it be easier for this type of data, since it's being collected already, to be reported for public health analysis. And then in the category of practice, a couple of potential implications or thoughts for the future. One is this type of work definitely gives the school administration incentive to consider or to make health and PE part of their core curriculum. I mean, again, if your mandate is to improve learning, and that learning is being measured by standardized tests, and this can help that, then why shouldn't it be part of the core curriculum? The second thing is to really educate schools, and when I say schools, I mean both administrators and teachers, on the association of physical activity and standardized test scores. There's a recent survey, which is pending publication, that showed that less than 40% of teachers were aware that there was even a connection between physical activity or fitness and standardized test scores. The third recommendation was to really consider in the design of PE programs an emphasis on cardiovascular fitness and core strength as opposed to body composition. Because again, when we looked at BMI on a pure basis without any of the fitness that might be associated with it, it had less impact, at least on academic achievement. It still may have impact on health, but on academic achievement, cardiovascular fitness and core strength seem to be where the action is. And then as we talked about, sustaining those PE requirements during the onset of adolescence. So that's basically a summary of what questions we asked and what our population of study was and what our results were. And what our implications are.
Great. Thank you, Steve and Duncan. As I said, every time we do one of these webinars, I always learn something new. And we've had a couple of questions for you, Duncan, with respect to your presentation. The first question comes from Michelle, and she asked, were the same students tested for reading and math?
Yeah, that's a great question. And the answer is yes. So one of the reasons that we focused on the reading and math tests was because the same students were being tested. Those tests, at least at the time, were required of every grade 3 through 11. So yes, it was the same students. And why such a difference between the two? Well, that's a great question. That's a $64,000 question, and that's where I was joking that most research ends up with a conclusion that more research is needed, and that is something that more research is needed into. There were some of the studies that came before us, although they had smaller populations. Some of them did find a little bit of a tendency that there was more association on math, and we don't know why. That's something that needs to be really addressed.
And can we go back a couple of slides here? Got a question here from a wonderful child health advocate for over 2 decades, from Jolene. She asks here, do we assume that the white counties did not have significant populations of data in regards to tech schools? These white ones here.
Steve, can you answer that question?
Yeah, I think that is a safe assumption. I will admit I got this slide, I think, 2 years ago, and it came from groups up in Dallas at UNT who did this study, so it wasn't mine myself. But Yeah, as you can tell, a lot of those are up near the Panhandle, where it is very sparsely populated. And I must say, not every, and I don't say this, I don't know if this is true, but in many schools and school districts, they're still struggling to get the fitness gram testing completed. And this is a messy business, collecting all this data from all the kids in the state of Texas. So it's not surprising that some things happen along the way.
Right. Duncan, as a result of your work from the get-go, was there something really surprising that you learned after completing the study?
Well, that's an interesting question. I think the for me the two most surprising things were, number one, that the associations were not even across the age groups. And again, we had enough data that we had the luxury of really breaking it down. And we basically did a separate analysis by age group, and you could see that it wasn't even. It really wasn't. And having that concentration in that kind of early adolescent period, I thought that was a very, very interesting conclusion that we were not expecting. And then the second thing was the BMI. We really thought that BMI, because BMI is such an important health indicator, we thought that if there were connections between fitness and academic achievement, that they'd be there for BMI. And when we stripped out all the kind of so-called confounding variables, we really found out that there wasn't. So I think those were probably the two biggest. I don't know, Steve, if you want to add to that.
No, I think those were the two big findings. Well, first of all, that this association appears yet again, another of many, many studies too that have held up, particularly cardiovascular fitness and the academic achievement. But the distribution across age is pretty interesting too. It's a puzzler, so we scratch our heads a little bit. And but it's nice that this study confirms it, confirms in a rather significant way. In a different way than other studies that have reported, because what Duncan did is kind of hard to understand a little bit, because the slide we're looking at is taking all the data aggregated together by county and just relating it, whereas in Duncan's study, he looked at individual kids and allows you to get that fine-tuned sort of way of understanding that he noted, particularly in those age distribution slides.
Yep. So a couple questions have come in about some of our confounding variables. So the answers, I probably won't be able to do justice to the answers in those periods of time. But basically, what we did, one of the benefits of doing this study in Texas was that reported as part of both the fitnessgram data and the standardized testing data were some demographic identifiers about those individual students. Primarily the ethnicity, and also the socioeconomic status, which is measured through access to free and reduced lunch. So it's really divided into three categories: 1, free; 2, reduced; and 3, no subsidy. So we were able to get, we were able to essentially have a 3 different variables on socioeconomic status, and then we were also able to have whatever number, I think there were maybe 5 different ethnic categories. And what one finds generally in these types of studies is that the minority populations, except with the exception of Asian, usually African American, Native American, and Hispanic ethnicities are associated with lower levels of fitness and lower levels of academic performance. And the lower socioeconomic brackets are also associated with lower academic performance and lower fitness. So what we did is we essentially implemented a variety of statistical controls to handle that effect, so that we were essentially comparing people that were situated in a like way, because we didn't want the the correlation to be due to socioeconomic status or ethnicity, as opposed to trying to look at a pure correlation between fitness and academic achievement. So yes, we did. And for those that are interested in some of the statistical details and the methodology behind it, we can certainly kind of provide a more detailed explanation on how we did it. Another question is, and Steve, this one might be for you, is can you talk a little bit about how many days a week typical districts in Texas have PE and whether or not they do many physical activity breaks during the day?
I can talk a little bit about that. Of course, look how big our state is. There's almost 30 million people in the state of Texas. So I can't say with any certainty about exactly what schools are doing, but if you follow state policies, school children in elementary schools are required to have, I'm blanking on it, I believe it's 160 minutes of physical activity a week. And middle school is 200. Go ahead, Peter.
Yeah, no, it's a 135, Steve, or they can provide 30 minutes a day. So if you do the math on that, that's a Texas Board of Education.
Yeah,
yes.
and then middle school is 225. So the point is that there are requirements for elementary and middle school. There are not the same kind of requirements for high school. So you always have to take the grade level in consideration when you're thinking about what's being asked of students at school. However, there's a lot of sporting activities and other activities too available to children. That is challenging to measure. So anyway, there is physical activity going on, and in terms of classroom activity breaks, that's not really reported anywhere that I know of on a statewide level. But what I can say is that the program that I'm partly responsible for, Catch, is one where we do have materials available to schools, and it's one of those programs that's been approved by the state of Texas. So a lot of schools use Catch in elementary and middle school. So if they're doing the program correctly, they are doing classroom physical activity breaks, but I don't know how many. In one of our own studies where we measured it in Central Texas, we were getting, I believe, up to 50% of the teachers willing at least to do several classroom activity breaks a week. So if I had my way, though, I would prefer to have a teacher do a classroom activity at least twice a day in the 5 to 10 minute category, possibly even more. I personally believe in schools that have a block scheduling of 90 minutes or more. It's a perfect time. So that means usually the middle school and high school kids. It's a great way for teachers to have some time for transition between different activities in the class. And uniformly, when I've been in the classroom and watched teachers do this, the kids like it. They ask for it. I think activity breaks are a really good idea. If you look at the new IOM report that came out last year on the whole school idea, they highlight a lot of good research on activity breaks.
Great, thank you, Steve. Another question came up as to where the study is published, and the answer is published in the Journal of School Health, which you should be able to find through Google Scholar. If not, if you send one of us an email, I don't know what the easiest way to do that is, but we'll put up our email. Yeah, if you send Peter an email, we'll get you a copy of the study. Another question came up as to could we conduct a study or intervention that eliminates the disparities and offers those students in lower achieving economic and ethnic categories the opportunity to become more physically fit, and then see how that impacted, and that is indeed one of the major goals of Catch, which is disproportionately implemented in those Title I type schools that tend to have lower socioeconomic status and a higher preponderance of minority populations. So I don't know, Peter, if you want to address that a little bit, and the work that Catch does to help basically narrow the gap in terms of physical fitness with those disadvantaged populations.
Well, certainly everybody's involved and very culturally sensitive to each community. And so teachers are taught strategies to manage and increase those amounts of physical activity and find them during the school day as well. So I think, what we've learned clearly today also just reinforces some talks I've heard recently by the Secretary of Education, the superintendent in Texas just last week, about the need to take care of the whole child and look at the school day for opportunities to provide physical activity so the kids do have that opportunity to be active. And then, of course, not to mention providing them with a quality physical education program at every school, and hopefully every day.
Do you want to talk a little about specifically the outcomes and barriers that go along with that type of intervention?
Well, it's usually, it's a communication, it's education, it's top down, bottom up, administrative support. And I think administrators are starting to pay more attention to this. The old healthy child is a better learner. Well, I think we've got that message now. Your numbers show that clearly. And I think administrators, particularly Steve cited a study earlier by Dr. Nancy Murray, where they did provide the kids with 60 minutes of moderate to vigorous physical activity every day. And we saw math and reading scores improve. They also used the Stanford 10 test as well. And as Steve said, the children that were at risk in those classrooms performed 3 times better than the regular classroom student, which equates to about 10% improvement on those standardized tests. So I'm not sure what administrator wouldn't be interested in that sort of data. And you alluded to healthy children turn up to school more. Attendance means dollars. So it's an economic perspective as well. I think it's a win-win. So I think is there one more question up? Yes, one more question, and then we'll probably be out of time.
Somebody asked us to put this slide back up around implications. So we're doing that, and if there are any particular questions on it, please send them in.
And just a reminder, the slides will be posted on the catchusa.org website, along with an archive of this webinar. So,
great. Well, I think that there are no more questions at this stage. I think it's been a very interesting discussion. Steve and Duncan, thank you so much for your time. Thanks so much for all that work. And wow, 315,000 students contributed to this body of knowledge. That's pretty impressive. I know in Texas, I had the fortune of being at a conference earlier this week, and I guess the presence of folks working so hard within their schools and their districts to do just this very thing, provide the kids with an all-round education and paying very close attention to their health, the amount of physical activity they're getting on a daily basis, and the impact of a quality physical education program on the children. So thanks everybody for everything you're doing to create and support that environment within your schools and within your communities. It is making a difference across the state, and hopefully soon we'll have some data to demonstrate that. So everybody else, enjoy the rest of the week. We look forward to joining you next month in our next webinar. Bye for now.